The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Brian says, good morning, Dr. Doreen and Shannon. Just thought I would contribute and ask for any input on medications to address. My 6.5-year-old seems to be diagnosed with, in addition to medium functioning ASD, inattentive ADHD, ADD. We are considering meds since his lack of focus is seriously impaired and his learning in class at home. In short, it is quite bad right now, despite his 98% plus IQ, except for pragmatic. Okay. I will add that his inability to complete anything at school has magnified what was largely already a large amount of self-critical words. I hate that self-critical words, and physically pounding hands, legs, and head.
Okay.
Sending you a hug.
Great. So happy that you reached out, Brian. Let's talk about this. This is one of those scenarios where you can actually intervene right away and make a huge difference in your child's life going forward. So he's only 6.5, which is terrific. And it sounds like he's very high functioning, 98 plus IQ, which also to me implies that he's got quite a bit of language because most IQ tests are language based. So that's all really good news. What it sounds like to me is that he's having a really hard time receiving information because he's unable to attend for longer periods of time. And as a result of that, he's starting to really have self-esteem issues, right? So he's starting to feel bad about himself because he's not keeping up, right? And especially with kids who are like normal IQ, what happens is they're very aware of their own failures, let's put it that way, and then they start really feeling bad about themselves, which is so important that at any level for any human being, how you feel about yourself is going to have a massive impact on how you do in life. Doesn't matter who you are, what you're doing. If you're not feeling good about yourself, it's going to really impact your life overall. So what I really suggest you do at this point is, yes, please do consult with a psychiatrist or neurologist about medications. There's absolutely nothing wrong with the medications for ADD, attention. It is ADHD, but yours is inattentive type, right? So there's nothing wrong. They would evaluate and determine if it's an appropriate thing for him, right? I have a lot of children who do tremendously better on some form of stimulant medication, which is the medication for ADHD. Now, recently, there's also medications, like a medication that might be really good for him, actually it would be probably a really good medication for you to try, is Strattera. Strattera is actually an SSRI, it's a serotonin reuptake inhibitor, but it is used for ADHD, and that might be kind of a cool thing for him because it might help him with the attention aspect, and it will help him with not feeling too anxious or down on himself. So talk to a psychiatrist or neurologist and figure out the medication part. It'll be life-changing for him, and it is important. And then I think that it is also important for you to kind of figure out what's going on in school. Like clearly, also I don't know what class level he's in. I don't know if he's in special ed, regular ed. That would be very important as well, by the way. Like for a child who has normal IQ, you probably want to make sure that he's not in special ed, or if he is, he's being reverse mainstreamed into regular ed so that he has a lot of opportunity to learn with other kids. If he is in regular ed, make sure he has help, because sometimes it's so difficult for our kids to keep up with stuff. Not because they're not capable, just because their functioning is a little different and they're distracted all the time. So make sure that he has help to just stay on target. and then he'll do well. It just sounds like he just needs a little bit of support right now to succeed. If you are able to get an ABA program, this is the type of child that does actually really, really well with high quality, good ABA. They would actually focus a lot on integrating into school. So what they would do outside of school is they would work on skills that have to do with attention. So some of the stuff that we work on with some of our higher functioning kids are executive functioning skills, things that have to do with divided attention, sustained attention, being able to set shift, go back and forth between two different activities and maintain attention on one versus the other. Lots of attention type drills or skills. And then those types of things tend to help significantly when the child is in school. It's one thing to pay attention to someone who's sitting right in front of you. It's another thing to pay attention to a teacher who's sitting far from you and you have a million things that you could be thinking about or looking at and being distracted by. So those are things that actually get better if there's someone practicing them with you. So you could be doing ABA to help those things in the afternoons, for example, and then of course in school it'll help your child do better in general. So I do recommend that you intervene both medically and behaviorally or cognitive behaviorally, get your child on the right path, and it'll be wonderful for him.